please be upstanding for the arrival of Her Excellency Professor the Honourable Margaret Gardner, Governor of Victoria, and Professor Peter Chung.
Please be seated. It's a bit of one of those chilly nights, but we'll close the doors and it'll feel a bit warmer in here, I think, over time. Let me acknowledge Jade Roworth, Chair, and Alex Stanford, Helen Gents, Chief Executive Officer, and Professor Peter Chung, Director Emeritus, members of the board and supporters of Musculoskeletal Health Australia, and all distinguished guests who are here. Let me begin by acknowledging that we are in this house on the lands of the Wurundjeri and the Boonwurrung peoples of the Eastern Kulin Nations, and pay my respects to their elders past and present. I'd like to begin by hoping that it's warm enough for you here. You might want to close those doors at the back too. So, thanks, Patrick. Volume of room, warmth of air. Give the fires their best chance. I'd like to begin by congratulating Musculoskeletal Health Australia on the success of the world's biggest sit-in that I know took place last year, and I hear all the plans for what will happen next. I was delighted to learn that the event broke the national record with more than 300 people participating, but I gather bigger things are in store. But in bringing to people, via that means, a way of bringing to people's attention the key issues that that Musculoskeletal Health Australia is interested in. It's a great pleasure to host this event this evening, and I gather you're preparing to break the world record next, but a bit later this year. But more importantly, the overall mission of the organisation is a crucial one. We are very fortunate in this nation and in this state in particular that we have, in fact, world-class both medical research and health systems. And many people around the world would feel very blessed if they were fortunate enough to have what we have. And that combination allows us to embark on activities that go to push the frontiers, the things that will provide better health for everyone. And in this particular case, the mission is the impacts of musculoskeletal conditions, which are significant not just for their impact, obviously, on the individual, which is very significant, but also for the prevalence across society. It is true that in Victoria we will know many people who in one way or another are affected in this way, and one of probably the most common conditions that we know is arthritis, for example, affects daily the lives of about 1 million Victorians. But beyond statistics are all the ways that lives are constrained by one of the burdens of these conditions, and they touch all the parts of people's lives. And when, with some of the conditions, every waking moment becomes a challenge, and when no task is simple, and when there is a concern that tomorrow will not be better, we really do need all the options possible, both in terms of research, but in terms of not just how we remedy a condition, but we want the remedies to be good and more effective over time, the way we mitigate the effects of conditions, and most of all, how we might have research and various ways of attempting to prevent as much as possible, because in fact the aim of medical research in the end is to prevent. So having ways to deal with options for dealing with what comes in the various conditions we can talk of is very important, because they affect the health and freedom of countless individuals, and they have an impact therefore on everyone with whom they're engaged, particularly their families and loved ones. So Musculoskeletal Health Australia's vision, as many of you will know, is to rid Australians of the negative impacts of the associated conditions by 2050, which is, can I say, a very bold goal, and one that will require significant innovation and significant commitment in order to be reached. But on the journey to reach a goal such as that, we can anticipate that many lives will have been improved. When I was looking at this organisation, I was reflecting back some years. My son did his master's research on an exoskeleton that would actually would be able to be attached to people and improve their ability to exercise more effectively, and so reduce the need for the amount of physiotherapy that's often needed. And I look back, and that research is now some years ago, and he's moved on to do other things. But I must admit, I always thought that it was a worthy goal and one he perhaps should go back to. But I can say this in this room because he's not here. I think all the things that will make a difference are very important for all those reasons. And I'm confident that you'll reach your goal of the world's biggest sit-in and that you'll continue to go on and break records. And even if you didn't break the records, creating awareness of the range of conditions and the sorts of research and programs and support that's necessary to deal with the range of conditions that fall under the rubric of musculoskeletal health, that awareness is going to be very important, because from awareness comes broader conversations, and from broader conversations come the sort of commitments that make a difference. Because we're always better when we understand better what needs to be done. As I've said, we need more research to build a future of better treatments. Breakthroughs bring benefits. Sometimes they're short, sometimes they're long-term. Sometimes they're for particular conditions, but they then spur others on to other fields. And ultimately, we aspire to people living longer, healthier, and more fulfilling lives, because we always feel in that state that we all should be happier, and that's really what we hope all along that will be available to all of us. So what I hope that you are able to do is to make sure that people who suffer from musculoskeletal conditions will feel that people better understand what is involved, that there is more impetus to push for gains in the quality of life for any people who are affected. I want to thank you, and I'm not going to say the name of your association again. I've done pretty well without stumbling so far. I want to thank Musculoskeletal Health Australia for their dedication, all those years of lecturing, for their dedication in supporting those affected by these conditions, and the importance of advocacy. Just what I noticed when I was talking to the principals outside before we came in, it's the engagement, the constant thinking about what is needed for the next stage of advocacy. That's what will make all the difference. And let's hope that next time I see you, you'll be world record holders. Thank you.
Thank you, Governor. I now invite Professor Peter Chung, Director Emeritus, Musculoskeletal Health Australia, to the lectern.
Thank you very much. ladies and gentlemen, honoured guests, and especially Her Excellency the Governor of Victoria, might I say it's both an honour and a deeply personal moment for me to stand before you, and we gather to launch this vital initiative led by Musculoskeletal Health Australia. For over 30 years, I have been a surgeon here in Victoria. I've served in an area working at the intersection of science, compassion, and human frailty. And over those years, I've come to understand that the disease which we're all talking about is more than just a medical condition. It is a thief of movement, dignity, independence. It affects not only your bones and joints, but lives and livelihoods. I've seen this not just in the operating theatre each week, but in the everyday lives of my patients. In clinic today, a tradesman whose arthritic knees ended his career a decade too soon. A young woman in chronic pain who withdrew from work and community. A grandmother, once the heart of her family, now confined to a chair, watching life from the sidelines. These aren't just case studies, these are people. And each day I face these stories and they stay with me. Today's event, the 2025 World's Biggest Sit-In campaign, officially launches here as a powerful reminder of these lives. These aren't just symbolic gestures. They are calls to action, to pause, to stand up, and to get moving together. This campaign, streamed live across Australia, is not just about raising awareness. It's about rewriting the national conversation. It's about telling the truth that musculoskeletal disease is not inevitable. It is not a natural consequence of aging. It is not something that we should accept without question or effort. Let me be direct. These conditions affect more than 7 million Australians, more than 1 in 3 of us. From back pain and arthritis to osteoporosis and soft tissue disorders, these diseases reduce the quality of our lives, undermine economic participation, and impose an enormous burden on our health system. The numbers are sobering. Let me share them with you. Musculoskeletal conditions are the leading cause of disability in Australia. They account for over $12 billion in direct healthcare costs each year. Lost productivity, another $10 billion annually. And that doesn't include the cost to mental health, family life, or social inclusion. These figures represent lives lived in pain, days lost to discomfort, and futures shaped by limitation rather than potential. But the most powerful truth is this: we can do something about it. As a surgeon, I have the tools to treat diseases, but as a society, we have the power to prevent it, to invest in movement, in awareness, in education, and in community-led change. That's why this initiative matters. Let me also speak from a very personal place. Both my parents are in their 90s. I visit them over the weekend, and I see that the struggle they endure. I watch once simple movements like getting out of a chair, walking across a room, now take incredible effort. And I see what that does to them, not just physically, but emotionally. That slow loss of independence, that quiet retreat from the world, and I feel it as a son, a doctor, as a citizen. Their experiences, though, is not unique. It's the story of thousands of families across this country, and it is why we must act with urgency. Musculoskeletal health isn't just about joints and bones. It's about mobility, mental well-being, social connection, and dignity. It's about the ability to work, to play, to care for others. And it's about the difference between living and merely existing. So today we say clearly and without compromise, musculoskeletal health is non-negotiable. It must be a national priority. And the time to act is now, not tomorrow, not when the system is overwhelmed, but today, while we can still prevent the preventable. Let's talk about movement. Movement is medicine. Movement builds strength. Movement restores independence. And movement connects us to our bodies, our communities, and to our own sense of self. Yet too many Australians aren't moving. They're sitting at desks, on couches, in cars, and with that stillness comes stiffness, and with that stiffness comes discomfort, and with that discomfort comes withdrawal. That is what makes the Sit-In campaign so powerful. It shines a light on the problem, but more importantly, it invites action. It reminds us that to live well, we must move well. That's more than a slogan. It's a philosophy. It's about embedding movement into our daily lives, our schools, our workplaces, and our communities. It's about creating environments that support physical activity not as a luxury, but as a basic, essential part of living. We need to promote early intervention, encourage lifelong physical activity, design cities and neighbourhoods that support movement, provide culturally appropriate and inclusive programs, and advocate for policy that embeds musculoskeletal health into public health strategies. We also need to support our health workforce, our researchers, clinicians, physiotherapists, and community workers who are on the front line every day. They are essential in helping people regain mobility, reduce pain, and reclaim their lives. But none of this can happen in isolation. It requires partnerships between government, community, healthcare, and individuals like us. It requires a campaign like the Sit-In to not only raise awareness, but build momentum. And it requires each of us to take responsibility for our own movement, our own health, and our own role in shaping the well-being of our society. We are the CEOs of our own lives. And as I close, let me say this. We are at a turning point. We can either continue down the path of rising disease burden, lost productivity, and personal suffering, or we can choose a different path, one of prevention, empowerment, and shared action. I know which path I'm choosing, and I hope you will join me. Let us move because it's what we're built for. Let us act because the need is urgent. And let us lead because the lives and futures of millions of Australians depend on it. Thank you.